वेलकम टू RRB NEXUS। इन आवर रैंडम क्वेश्चन एंड आंसर सेशन हमारा प्राइमरी गोल है कि आपकी परीक्षा से पहले हम सभी सवालों का कवर करें जो कि परीक्षा में सबसे ज्यादा संभावित हैं। और ये सवाल पिछले वर्षों के नॉर्सेट, AIIMS, RRB, ESI, PGIMR की परीक्षाओं के प्रश्नों पर आधारित हैं। Join us regularly to make sure your selection.
Which of the following is a contraindication for gastric aspiration from an NG tube? A. Hypertension. B. Diabetes. C. Esophageal varices. D. Severe dehydration.
And the answer is option C, esophageal varices. I. Hypertension, high blood pressure. Not directly related to gastric aspiration. Not a contraindication. B. Diabetes, condition affecting blood sugar. Not directly related to gastric aspiration. Not a contraindication. C. Esophageal varices, enlarged veins in lower esophagus. Caused by liver disease. Inserting tube may cause bleeding or damage. Contradiction for gastric aspiration from NG tube. D. Severe dehydration, significant loss of body fluids. Not directly related to esophageal varices. Not a specific contraindication for gastric aspiration, but can pose challenges during the procedure.
Which of the following is the correct term for temporary cessation of breathing? A. Dyspnea. B. Bradypnea. C. Tachypnea. D. Apnea.
And the answer is option D, apnea. Dyspnea, incorrect. Dyspnea refers to difficulty or labored breathing, not temporary cessation of breathing. B. Bradypnea, incorrect. Bradypnea indicates an abnormally slow breathing rate, not temporary cessation of breathing. C. Tachypnea, incorrect. Tachypnea is rapid breathing, but it does not involve a pause or cessation of breathing. D. Apnea, correct. Apnea refers to the temporary cessation or pause in breathing, which can last for several seconds or minutes. It is the appropriate term for this condition. The correct answer is option D, apnea, because it accurately describes the temporary cessation of breathing.
Which of the following is the known action of metronidazole? A. Analgesic. B. Antibiotic. C. Antipyretic. D. Sedative.
And the answer is option B, antibiotic. Here are the key points explaining the action of metronidazole. Metronidazole is an antibiotic medication. It is administered through injection. Its primary action is to combat and treat bacterial infections in the body. It interferes with the DNA synthesis of the bacteria. By doing so, it inhibits the growth and reproduction of bacteria. This ultimately helps to eliminate the infection. Metronidazole is not effective against viral infections. It is commonly used when bacterial infections are suspected or diagnosed. Remember, it is always important to follow the advice and instructions of a healthcare professional when administering medications.
Which of the following statements accurately describes the situation when a nurse observes a urine output of less than 100 milliliters over the past 24 hours in a patient with acute renal kidney injury? A. The urine output is inadequate, meaning it is less than the required amount. B. The urine output is normal. C. The urine output is more than expected. D. None of these.
The answer is option A. Because a urine output of less than 100 milliliters in 24 hours is considered inadequate or below the normal range. In a healthy individual, the kidneys filter and produce urine continuously to remove waste products from the body. The normal urine output for an adult is around 1 to 2 liters, 1,000 to 2,000 milliliters, per day. When the urine output falls below 100 milliliters in 24 hours, it indicates that the kidneys are not functioning properly, which can be a sign of acute renal kidney injury. Monitoring and maintaining an adequate urine output is important to ensure proper kidney function and prevent complications.
And for additional queries, search on YouTube RK Edu Nexus, and get brief note on topics, join our Telegram channel, same name RK Edu Nexus.